So I'm excited to introduce our next guest. We have two amazing doctors here. We're going to be talking about a topic that I don't think we talk enough about. Welcome, Dr. Saunders, and welcome, Dr. Saunders.
Thank you.
Well, before we get started, I wanted to talk to you guys about, first of all, what exactly do you do in your practice, and where's your practice located at?
Sure.
So our office is Core Therapies. We practice in New Jersey, Florham Park, New Jersey. CoreTherapies.net is our website. We have mostly chiropractors. We have 8 different chiropractors. We all specialize in different aspects of chiropractic. So we have a few who do functional medicine, functional neurologist. We do pediatric, prenatal, postpartum, sports injuries also. But we treat lots of families, a pretty broad range of conditions as well. Of course, children on the spectrum is a big part of that as well. So.
And so often, you don't sometimes think when you get a diagnosis with a child with autism, your first thought isn't chiropractic care. So can we talk a little bit about why that's so important for us to incorporate that into our therapy methods?
Sure.
I think one main thing that we take from the chiropractic philosophy is we're not changing these people. We really believe that your body was designed and born to be healthy, and sometimes there's interference that affects that. And so our job is to peel back these layers, whether it be through cranial sacral or through detoxification or through chiropractic or through hyperbaric action to get to the core that's your child. So we're not changing anything, and I think that's what's really neat.
That's beautiful. And I know you do way beyond chiropractic, right? So can we talk a little bit about that as well? Because chiropractic involves many different layers, correct?
Correct.
Right.
Yeah, so like I said, we have a handful of different doctors besides the two of us, treating people. So it just really depends on what the issues are, what they're coming in for, what different tests. So we might run, blood panels and urine panels and hair panels. We're trying to figure out what are the underlying issues, because once we understand that, we can put together a plan. Certainly by no chance is every child, coming in, let's say on the spectrum, getting the same treatment. It doesn't make sense because they all have their own variety of issues. So we need to put together a plan for them that matches those issues. So, we're really looking at trying to get, like Melissa said, trying to get to the cause of, where that all came from in the first place. And,
and get back to the core person and let them shine. That's what I mean by not changing. Like we're not changing your child. It's still your child. We're just getting rid of anything that's making it difficult for them to be themselves.
Right.
And so often when we think about chiropractic, I know for myself at least, because we have a chiropractor, she comes and visits our home. She's been working on my son, probably at least 11 or 12 years. And insurance now pays for a lot of chiropractic care, which is fantastic. It didn't used to, so that's really great. I think this probably depends on your state from what I understand. But a lot of people still think of chiropractors just doing the basic adjustments and such, and it sounds as though you guys go well beyond that.
Yeah, what I usually tell parents when they're coming in, if they're concerned at all, especially with the craniosacral, is when we're working with children, the amount of pressure we use is about the amount of pressure you would use to check a tomato. So it's super gentle. Kids actually love it. Sometimes they're a little bit tentative their first visit, but we give them the time that they need to feel comfortable. And often kids will come in and jump up on the table. They'll sometimes sleep through an adjustment. It's super relaxing. The kids are comfortable. The parents are usually really happy once they see that too.
Do the parents also get adjusted with you guys?
A lot of them do, yeah, because they're going through a lot and they need it too, for sure.
Yeah, I know our chiropractor who comes to our home adjusts our family on top of our child, and it kind of becomes like an entire, everybody's going to feel good, after this. I think it's really important. Some of the things we notice is calmness after an adjustment. Is that something you see in your practice?
Absolutely. And for the kids
parents.
and the family.
Yeah,
Right? So, the premise behind the chiropractic treatments is really trying to handle the nervous system, trying to take the nervous system and balance it, or have it relax a little bit, balance between the, the stress mode, let's say, and the, so the sympathetic and the parasympathetic sides of the nervous system. So when we could balance the nervous system, everybody feels better. You feel calmer, you feel clearer, so it really helps both child and parent for different reasons, but in a similar way.
I know many parents get nervous that their child's not going to lay on the table or they're not going to be adjusted. Do you guys use something called an activator?
We do, yeah. We have an activator that we use, and then we also have a toy activator, so the kids get to use it too. It's in our office at least, it's very interactive. Our room is attached to a playroom, so we'll adjust in the playroom. It's wherever the kids are comfortable. Right. So it's definitely
fun. They're on the table for a few minutes, and then, they're not, and that's okay too. And
Yeah,
so,
you're chasing them with the activity.
Yeah, it's super family friendly. It's whatever
we might adjust
need,
the mom, let's say, for a few minutes in between,
Mhm.
the front end of the, the child's adjustment too. So it's pretty. I mean, we're very relaxed, it's very comfortable the way we handle things in our office.
And what is your recommendation when someone's looking for chiropractic, care? Is it weekly? Is it different per person?
I think it's really different per person
Yeah.
for sure. So we usually figure that out within the first few sessions, because if you notice that they're holding adjustments each time, then we definitely are going to spread out the care to make it easy on the parents. If they're not, then we're going to keep them closer together until they start to. And we're also going to give them stuff to do at home to make that easier so that they don't have to rely on us.
Right.
When I think cranial sacral, I think, I'd like to dive a little bit into that if that's okay.
Yeah.
A lot of people hear that word and it's like, well, what is that? Like, I know a lot of people watching. I'll be honest, I didn't know what that was until my son kind of taught me to learn a lot more than I thought I was ever going to learn.
Mm-hmm.
So can we talk a little bit about that? And is that different than adjustments?
Sure. Do you want to?
Yeah, so I'll start. I'll say that on the technical side, the nervous system is being fed through cerebral spinal fluid, right? So it's this fluid that bathes and feeds our nervous system. When there are imbalances in, I was saying before, the sympathetic, which we call fight or flight, it's like the stress response, and then the parasympathetic, the nickname for that is rest and digest. So there's two sides of that nervous system, one that's handling stress and one that's supposed to, help us calm. The fluid that moves through our nervous system helps create that balance. And so cranial sacral adjustments, I'll call them, are geared primarily towards trying to create balance on both sides of that nervous system. That being said, like Melissa was saying, you can fill in. I mean, those treatments are super gentle and very relaxing.
Mm-hmm. Like as you've seen, it's often it's just holding a certain position on the child or on the adult for a little bit of time. You'll see their body relax. You'll see them start to belly breathe and kind of like let go. Super relaxing. There's not.
When I get cranial sacral adjustments, I typically fall asleep.
Yeah.
So
can we teach parents how to get our kids to fall asleep?
And they're definitely.
Is that the homework you give us?
Yeah, there are home techniques that definitely help. Yeah, totally.
I know that's a really big problem for a lot of us, especially early on in autism. The sleep factor of trying to help.
I feel like that's part of it too. That calms the parents down though, because a child getting adjusted or getting craniosacral or any of the techniques in our office, it's going to make that ride home even more relaxing. Like the kid's not screaming or crying in the back. They're more relaxed. So, and that transfers over into home life too. So it's huge, like Jason was saying, for everybody, whether or not the parents choose to get treated.
And how long is a treatment typically?
Again, we kind of follow the family. First visit is usually about an hour. After that, they're usually 15 to 20 minutes, but sometimes more if it takes the child, particularly first or second visit, if it takes them a while to get on the table, if they need to run around the playroom, we create that space so that they have whatever they need.
It could also be shorter if, they're happy to get on and they climb aboard and we do our thing. So, it's kind of flexible for us in our office.
Yeah.
I know, at least with my experience, and please, I'm curious your take on this. We had some issues with fluid in the ear when he was younger, and they wanted to put tubes in his ear, and in his ears, I should say. And so I went online, like all of us moms do, and Googled to see, I didn't want to have the tubes put in. Was there an alternative method? So we were on a waiting list for surgery, and it took about, 25 days out or so. And so in that meantime, I found a chiropractor because I read that sometimes that helps. So I thought, gosh, I might as well try it, right? Yeah. And so I found someone. We did do it. I think it was like 5 days a week. I decided to be really intense with it.
Give it a shot. Go for it.
Yep. And we went in day before surgery, and to have them looked, they had to check right before. And the doctor looked at me, and he said, "What have you been doing?" And I'm like, "What are you talking about?" I said, "We were going to chiropractor." And he goes, "No way, that's not possible." And there was no
Just
fluid. Apparently it was a coincidence. There was no fluid, and we had to cancel surgery the next day. Now, I'm just going to attribute that was the only thing I did differently. Like there was nothing else I did. So have you seen that ever in your practice?
Yes, we see it often. We have people come in specifically for that to try it. We also have people come in that they're like, listen, I'm dead set. I'm getting the tubes. Like, I want to use both sides of medicine, and we think that's great. And we just do whatever we can to support the system because often they won't have as much fluid when they go in, and so they'll do better from the procedure anyway. But yeah, we see it all the time. That's one of the main things kids come in for.
Really? Okay. So that makes me feel better.
Yeah. Now, and again, you're just, we're just helping their system work better. So it's not like we're getting rid of the fluid. We're just allowing the body to do what it's trying to do.
When I think with chiropractic, I think it's really, at least this last decade, you're hearing more and more about it accepted, at least in the general public.
Sure.
And it's really acceptable compared to where it used to be.
Right.
It didn't seem, it almost felt more alternative. And I feel like it's really become more mainstream now.
Definitely.
And how do people find you guys again? Do you guys have a website?
Our website is coretherapies.net. We're pretty much referral, word of mouth.
Yeah, like 90% word of mouth, pretty much across the board. You know, I guess there are other techniques and things. So between like the detox that we do, sometimes people find us through that particular program.
Okay.
We also have Hyperbaric, and that's a separate business, a separate website also. So people find us that way and end up coming in and saying, "Oh, you also do this or do that." So there's some combination of that, I think. But yeah.
So with children with autism that you treat, you're looking at detox, you're looking at adjustments, you're looking at hyperbarics as well. Can we talk a little bit about that?
And the functional neurology too.
Again, and functional neurology is a big part. So again, it's all about the child and their needs. So some kids, we have a pretty good idea that hyperbaric is something that's going to dramatically change their story sooner than later, so we'll start there. Somebody else, we might get metal tests back or other environmental toxin tests back or other allergy tests back and realize that we really need to calm the immune system first. We had to do some detoxification. We have to clear things out of their system before we could do hyperbaric or before so between dietary changes, adjustments, we offer a variety of tools, but again, it comes down to each case, each kid, each story.
And part of what we like about offering the variety of tools is we don't have a set protocol. So, we may have two people come in that are connected, that are friends, and their kids will receive completely different care based on what they need. And, having all these tools allows us to do that. So it's not like cookie cutter treatment for anybody.
That's fantastic, and it sounds as though you have many different resources, almost like a menu.
Yeah.
Right, we try. We're not to necessarily be everyone's answer, but like Melissa's saying, we feel better knowing that each tool is great on its own, and at some point along their journey, the child may visit a few of those different tools, or even need a few at the same time. But the more we can offer, the more solutions. I know these parents are typically very stressed. They've already been to 11 or 12 or 100 doctors. You spend a lot of money and time. Trying to simplify things for parents is a big part of our goal.
What's nice too is with a lot of these tools under one roof, we're all collaborating. So the parents and the families really have a team. Like the functional neurologist is in contact with the person doing craniosacral, who's in contact with the person delivering H-bot, who's in contact with the person doing detox. So it's this whole team approach, and we're working together so everybody knows what's going on.
That's fantastic. Well, if you had one message to these families that are maybe just first getting the diagnosis for the first time, it's really scary. You're told that your child has autism, and there's really no map or no guide that tells you what to do after that. What message could you give those parents?
I would say go with your heart, go with your gut. I'd say there's a lot out there. Don't ever give up hope. Find the people that you feel good about, that you trust, and always, always trust your gut.
Similar, I think we need a team. We need a team of people who we can trust. We have to work together on that team. It's always going to be a collaborative effort amongst the doctors and the parents. And I would also say that, many times when we're talking to a parent, we try, let's say, gluten-free diet for a month. Well, that didn't seem to work, so now we try a dairy-free diet for like a month, and I'm not sure if that worked either. And then we try hyperbaric for a month, and maybe it helped a little bit, but I'm not sure. A lot of times it's the synergy of multiple things happening simultaneously. In some of these cases, I'm just using these as examples, but it might be you had to be gluten and dairy free and it had to be simultaneous, or it was, a combination of cranial sacral to control the nervous system while you're detoxing and getting hyperbaric. And I'm not, each case again is different, but if you do enough work ahead of time to understand
which pieces are important together.
For that.
So you're not just shooting in the dark with all these things that are so difficult.
You get a program of, okay, here I'm understanding a bigger picture of why we are in this place, and now I have a plan of action that's going to put together all those pieces. I think that's probably one of the most important things.
Well, I absolutely agree. It's definitely a team effort, and there's so many pieces to this puzzle.
Yeah.
And thank you guys so much for being one of those pieces.
Thank you, Kristen.
Thank you.
Thank you so much.